My name is Dr. Piya Gandhi, and welcome to my podcast. My guest today is Allison Evans, co-founder of Branch Basics, and I have had the privilege of treating her children. So I'm really excited to talk about your work and how it really intertwines with the work that we do, your experience as a parent, going through the expansion process, and also doing some work on yourself as an adult.
Exactly.
And what that journey has looked like. So welcome and thanks for being here.
Thank you. I'm so excited to be here. This is so fun.
Yeah. So I'd love for you to start just by sharing your story. Perfect. I know Branch Basics came out of a personal journey.
Yeah, you and I have that commonality,
yes.
Right? I mean, our kid, we're suffering, or our kid is suffering, and we're like, okay, no, this isn't working. We need to dig more.
Yes.
Root cause approach.
Yes.
So, yeah.
Yes. So,
okay, so Branch Basics in a nutshell, for those of y'all who are not familiar, I like to say started when I never had my second period, which is kind of crazy. But basically, I had my first period. I grew up here in Houston, Texas, standard American diet, all the different things in my house that I would now tell you to toss in terms of, toxic burdens. But I thought, okay, well, check mark. I'm 13 years old. I had my first period. Don't really need to worry about it. But then it never came back. So I go to a top endocrine doctor here in Houston, and he diagnoses me with the worst case of polycystic ovarian syndrome he had ever seen. So I literally have thousands of cysts on my ovaries. This is before PCOS was kind of just like layman terms, right? Now I think it's 1 in 8 women are diagnosed with either endo or PCOS, which is wild, all the endocrine related issues that we're facing today. But I remember asking the nurse practitioner, is there anything that I can do? And she said, no, this is genetic. It's becoming more common. Take birth control indefinitely, and you will never be able to conceive naturally. But thankfully, you can come back to us when you're ready, and we will help you get pregnant. So if you had a white coat on, you're pretty much second to God, in my opinion, back in high school. And I'm like, great. Didn't even question it. So I'm the girl with PCOS, and I will never be able to get pregnant naturally. So fast forward to college, I started coming down with mysterious pain that started as, oh gosh, I have a crick in my neck, or was I studying too much last night? All the way to a few months later, I am in PT. I'm doing acupuncture, rolfing. A few months later, I am on hydrocodone, muscle relaxers, sleeping pills, antidepressants. I'm like a walking drug den at 21 years old, and now traveling the country, seeing specialists. I mean, pediatric arthritis specialists. Early stage MS was thrown out, and my body's just crumbling. So my aunt comes in the picture, and she is this amazing, I absolutely love her. She's my co-founder now, but back in the day, I'm like, you're a hippie without any credentials. What are you talking about when you use the word toxins? But she basically described how our bodies have an innate ability to heal. And when all of these things are going on in terms of symptoms, they are sirens, and our body's basically saying, find the fire. Don't just keep taking the batteries out of the fire along with all these drugs. So continue to take the things that are keeping you comfortable, but we got to figure out the root cause. And she talks to me about toxins and how most of the symptoms we're experiencing today are genetic, maybe at their core, but genes load the gun and our choices pull the trigger. Yeah. So let's look at your diet, she's saying, and I'm like, everyone else is having Splenda and eating 100-calorie packs to stay thin. What's wrong with this? This was back when the calories were king. Yeah. And she's like, let's look at what you're washing your body with and using to clean your home, and the paint that you keep painting your dorm room a new color with, And I'm like, everyone's been doing this. I've been doing this my entire life. Everyone feels fine. She's like, but do they? Just because it's common, does that mean that it's normal? Oh,
that is.
And it's key, right?
Such a concept.
It is.
In the airway field too.
It is. Yeah. And you think, well, everyone else is doing this or everyone else is feeling this. But I started really learning about this idea that these microdoses of chemicals, whether it's things we're putting in our body or on our body or around our body, they needed to be removed so that my body could do what it knew how to do, which is to heal. And, if you pick a scab every single morning, it's never going to go away. But if you leave it alone, you'll look down one day and it's gone, And so we can't keep doing the same things that are these daily offenders. So I removed some toxins, from my diet and got rid of my, my Windex and my Clorox, not to name names, but candles, dryer sheets, things like that. And all of a sudden I'm like able to cut down on doses of painkillers, which is wild, right? And so upon graduation in 2008, I go out to the hill country in Texas where Marilee lives to live with her. Because I'm like, this woman is onto something. Yes. I've been to all the best doctors in the world. No, not one of these doctors asked me what I was eating or what products I was using or what I had in my home, if there was trauma, if there was mold. So that was the summer that changed everything. I drank juice. We walked barefoot. We limited cell phone use. I ate real food for the first time in my entire life. I wasn't eating out of a package, but like most meals.
Yeah.
And within 8 weeks, I was off all medication. 10 months later, I go back to the same endocrinologist here in Houston. Of course, birth control was not on Marilee's protocol.
Yes.
And all the cysts are gone. And so I had gone to her home because I was desperate to get out of pain. But when you go after healing one part of the body, other parts of the body are going to heal because it is a whole system approach. And the more inputs that we put in that are pure, the more our body will naturally just displace the toxins and the mold and the years of damage that we've done. So it was really eye-opening for me. I ended up trying 4 times and getting pregnant 4 times easily and naturally. And so the doctor really couldn't believe it. I mean, the cysts were gone. He said, "What have you been doing?" And I said, to be honest, I got rid of toxins, including birth control. And he said, "Just keep doing what you're doing. I've never seen a case like this." So that's really why we started Branch Basics, because we wanted to open people's eyes to the idea that it starts with removal. Take the things out that are burdening your body and then add the supplement treatments and the protocols and the saunas, the surgeries, whatever you may need. We're not saying don't do that, but don't continue to go back to a home and eat the same foods and use the same products and expect there to be a lot of change.
Yes. Well, it's the daily things, the high exposure things.
Exactly.
That really make a difference.
Absolutely.
And to your point, just doing that, the body will start to do the right thing.
Yes, and it starts making shifts. I mean, Kelly is my co-founder, and she's my age, and she went out to live with me in Marilee that summer because she thought, "Oh, okay, this will be fun. I'll learn a few things." But I mean, we said you either have to be sick or smart to jump on this train, and I'm clearly the sick one. But listen, Kelly went out there, and she leaves with all of her PMS symptoms are gone. Her dry skin, her itchy eyes, her cramps, all the things that, again, we think that are normal because they're so common. Yeah. And she hasn't had a cramp since. So it's pretty cool. It's pretty cool. Yeah.
That's amazing.
Yeah.
Wow. I didn't know that story.
Yeah.
So thanks for sharing.
Yeah, absolutely.
How has that, I'm sure it has hugely, but impacted like what you do with your children and the way you raise them? Because we are in an environment where what you're doing is not the mainstream.
It's
right?
not.
So, they're getting exposed to things wherever they're going. So how do you balance being in a world that is not where you are?
Exactly. Yeah. I mean, number one, it's made me question just about everything I ever learned. Right?
Yeah.
Which I think, and that's something that's affected the way I parent, because I want my kids to not have any fear, but I also want them to think for themselves and to question status quo and to respectfully push back and not just, take what they hear as the final word, no matter who it's from. So that's number one. Number two, I'm really, really big about not putting any negative words or notions in my kids' head about how other people do things, whether it's the way that they choose to feed their kids or the products that they use. And I don't worry when we leave our home, because I've created a home that I believe is safe for my children. It is free of synthetic fragrances. It is free of the pesticides that are known neurotoxins that undermine pretty much everything we do for our health. These pesticides are so toxic. So many things that my kids are not even involved in. They just happen to be raised in my home. So they go out in the world and they're exposed, and I don't worry because they're coming back to a home where the things that I can control, the things that are within my purview, I do the best that I can, and I don't impose that fear upon my children. And I empower them to make good decisions. I have my no-nevers, like we don't do food dye. I just don't. And so that's the one thing I can go to a birthday party and say, "Hey, we just don't do food dye." And it's not confusing for them. We don't do it sometimes and not other times. Yes. But then if my kids are in a healthy spot, and which all of them are right now, I'm like, sure, go have some sugar, go have some industrial, that's seed oils. I mean, it's not going to
such a healthy perspective, because
have to be.
We also live in a world of extremes.
Exactly.
And so I have encountered, parents where it's like so extreme that then they create these children that have complexes about everything. Yes, then they rebel. Yeah. But, also children they're watching all the time. So they're just picking up, even just seeing you and the way you have your home and the way you run your home and what's in your home. And I also love that you teach them to do their thing and respect what other people are doing.
Yeah, even within the Airway. Let's face it.
Yes.
They're getting asked all the time. I mean, I have a 9, 7, and 3-year-old who are in mouth jewelry, as we like to call it.
Yes.
And I mean, their preschool teachers are even like, oh, you have an expander. Oh my gosh, Eleanor. I mean, she's 3, but she got her expander. And I've had to give her the right words to say, oh, in my family, we decide to make our mouth a little bit bigger so we can get more air at night. But it doesn't work for everybody. You have to kind of, because you don't want to make other people feel bad or that other parents are doing it a different or a wrong way. I always just say, we're the Evans family and we do things differently.
I love that.
You know?
I hope every parent is listening to this.
Listen, it's
just
hard.
as a parenting tool, you know, because we do live in a world where so many things are done different ways.
Yeah.
And as adults get, you know, a little taken aback when they're not doing what everyone else is doing.
Yeah.
Or they start questioning themselves or they start judging somebody else.
Yes. Especially as parents.
Yes. And I mean, I've had to live this as a parent and a professional.
Yeah.
So, you know, in the Airway space, this is not your mainstream dentistry. It will become, I believe.
It will. Absolutely.
Because there's now so much coming out about it, but it still isn't. And so, you know, to your point, not trying to impose on other practices what they need to do, but also believing in what we do and why we do it and the benefit that can be from it. And looking at root cause, you know.
Exactly.
But it's also interesting because by me just, you know, making your airway anatomy more favorable, that doesn't fix every issue that's contributing to airway health and breathing health. And because everything is connected.
It's a whole system.
What we're feeding ourselves, what we're surrounded by, what we're breathing in around us.
Yes.
I will say the families that are more aware of toxins and nutritionally what they're putting in their bodies, their outcomes are much better.
Absolutely.
Can we move the needle for everyone? Sure.
Yes.
We can always improve. But if we really want to get like full body health, it can't just be right here.
Exactly. And listen, the body can only expend so much energy on doing things. So if you are a family that is eating the standard American diet, which science has proven doesn't have good outcomes, and if you're a family that goes and, you know, fills your home with disinfectants and pesticides and synthetic fragrances, which again, science is proving it doesn't produce great outcomes. The body, the system, the detoxification organs, the lungs, the bowels, you know, the kidneys, like they're having to filter all these things constantly. And so that energy is not then able to be expended on things like retaining the work that we're doing in your practice, you know? And it all goes back to nervous system. It all goes back to how much we're putting on the body and asking it to do when it has so many different inputs. It's not able to use the nighttime, which is the time that it does the most restoring and healing and basically assimilating all the inputs from the day, because you're breathing in synthetic, you know, fragrances in your dryer sheets and your sheets and your pajamas and your room sprays or whatever it may be, the dinner you just had. I do believe that my kids have had a lot of success in the things that we've been doing with you. And I think that they've retained more than a lot of children that I'm seeing because we've taken such a whole system approach into healing. So we're doing the body work and we're feeding them the things that are actually going to contribute to, they don't have low mineral reserves.
Yes.
You know, I mean, those bones, those cranial bones, they need support to actually retain, because in the end, what you're doing and what I'm doing is we're trying to wake people up and remove the things that are keeping the body from doing what it naturally wants to do. Like you are basically pointing the entire system into a direction that it was supposed to be in the first place.
Yes.
You know, and so if we can just give the body the space to say, oh, I get it. Yes, I'm going to stay here. Yes. You know, versus all the stressors that keep it
stimulated in the right way.
Exactly. I feel like I said that kind of in a convoluted way, but I think that makes sense.
No. I mean, we are essentially, when we look at airway health, for most of the children that I treat, we are putting them where they should be.
Exactly.
But the body then has to carry that work.
Yep.
So it's not a magical wand or bullet that works.
Right.
And the reason why children like yours are successful, and we're going to talk about their journeys, have been very individual.
Yes.
So
yes, some are more successful than others.
You know, you touched on Bodywork, but this is an interdisciplinary approach.
Yeah.
So Bodywork is basically the concept of our whole body is connected.
Yeah.
And especially in the airway field, if we're using expanders, when we're moving these bones, we're moving every bone in the body. We're also affecting nerve firing and, how our CSF is moving and nourishing our nerves and our spine. And so it is really beneficial when families see the value in, we have to work with these other practitioners and professionals to really look at the whole body.
Yes. I think it's very sad, actually, when I hear these parents who say, I found the airway person in my area. We're doing expansion. And then I ask about Bodywork, and they're looking at me like, wait, what? Because think about it. I mean, if the tongue has been weak and the palate has been narrow and everything's been out of place since the birth canal.
Yeah.
And all of a sudden there's these compensations that the body has been making every second of every day of their life that has created tension in that area. Just because you expand the palate, and do a little bit of myo doesn't mean that they're not going to go back to where they were, because you're not treating the entire system.
It has had a full body effect already.
Absolutely.
But that's not what our medical system is used to.
Right.
And, you talk about, I question everything I've ever learned.
Yeah.
Well, everything I learned in dental school was pretty much wrong.
Right. And 10, 12 years of it?
Too many. Yeah. 12 years of schooling. Wow. And literally, the reasoning behind why kids snore. Oh, they'll grow out of it. Oh, it's normal.
Oh, it's so cute.
We'll just take out their tonsils.
That's the worst.
Is where the common and the normal and the common thing comes in. It's like, families will be like, oh, well, I snore. And I'm like, well, that's not normal either.
Right.
All
of its friends got their tonsils out.
Yeah.
Okay.
So again, the being curious about what we've learned and questioning it. And it's still, and I don't think it will ever be, there's not one answer for every person and every child. We have to look at their whole body and assess as best as we can. But some things are going to work better in some bodies than others.
Yes.
And you have to be a practitioner and a person that's able to say, okay, let's take a step back. This is maybe not going the way we had intended. What else? What are we missing here?
But see, what you just said is where our professions have so much in common. It is so much easier to just be a dentist who wants the teeth to look pretty and white and have that perfect, beautiful smile. You can pull some teeth out to make it happen. Whatever you need to do. That is an easy approach. You don't need to rely on another discipline. You can just figure it out in office. It is just like it is so easy for a doctor to say, oh, there's the symptom. Here's the treatment or the drug that I can use to treat that symptom. So in both cases, you're not looking at why it's there in the first place. And what you're literally doing is putting a Band-Aid on or taking the battery out of the fire alarm, and you're kicking the can down a decade or two to horrible sleep apnea, low oxygen. I mean, your organs literally viscerally
your life will be shorter.
Absolutely.
Yes.
Same with not taking a functional approach to looking at why you're having a symptom in your body, which is why we say, okay, you keep having miscarriages. Great. Do the IVF, do all the things you're doing with your doctor, but also remove the endocrine disrupting chemicals that could actually be triggering a miscarriage.
Yes.
And,
in the medical professional, dental professional world, I think one of the biggest barriers to this is you are basically told in dental school that you are the authority, so you should know all the answers. Mm-hmm. There is no room or teaching or acceptance to say, you know what, I don't know yet. Mm-hmm. I need to do some digging.
Or I'm still figuring it out.
Yeah. And in any field where you're looking at root cause, it's not as simple as this symptom, this pill.
Absolutely.
You have to be able to put your ego aside and say,
absolutely,
you know what, I'm going to try this. And we don't know if it's actually going to work.
Yeah.
But we're not going to know until we try. And just being transparent about that. I mean, I had to go through this journey with my own children. Mm-hmm. They have been in every type of appliance I've ever tried. Mm-hmm. And they also had very different journeys. Yeah. So, something worked better in my older one and not my younger one.
Right.
And I always say, working with the human body is the most humbling experience.
It is.
And medical professionals, dental professionals, we are also human. We don't know all the things.
Right.
But we have to be okay saying that.
Exactly.
And putting ourselves in that vulnerable situation.
And I get that it's not easy to teach this in medical school. I mean, it's very hard to write textbooks about how, if someone's having chronic allergies, it's a lot easier to think, okay, well, you give them allergy shots or allergy medication versus here's how to teach them to look for mold in their home.
Yeah.
Right? I mean, that's not fun. That's not easy. That's not really teachable. I mean, and it's the same with what you're doing. So.
Yeah. So tell us a little bit about the journey with your 3 girls.
Yeah, I
what
mean,
that's looked like.
gosh,
And
I was trying to think
what
even
prompted
on the way
you
here.
to even start the journey.
I was really trying to think on the way here if Elena Williams, who's my osteopath, I think is to introduce me to you. And then I went on to introduce pretty much all of my friends to you, which I'm so thankful for. But I think just this idea that, one, just because my kids were born with their mouths open doesn't mean they should ever be open. I mean, the mouth should be closed.
Yes.
You know, and I'm like, oh, well, it's because my husband's dad kind of looks like that. And that's how his palate is. And so I'm going to make babies like that. Well, yes, I will make babies like that probably because he has some strong genes that I've had to work against. But I got to keep working against them.
Yes.
And I look at how he is now at 74. He's probably not going to listen to this. But if I were him, I would double jaw break in a second.
Yeah.
I would figure that stuff out because the amount of suffering that he has gone through with sleep issues, with sinus cavity issues, with the scraping of the sinuses, with all the infections, all of the throat clearing and the snoring. And I mean, that's not good for him.
Yeah.
You know? And so I'm like, God forbid I know what I know and I allow my girls to have to live that same path.
Yeah.
So I read the book, Breathe by James Nestor. That was eye-opening.
Yeah. I love that he wrote that book because it put Airway on the map for everybody.
It did. It was so good. Marilee, my co-founder's one who sent that to me one day. She doesn't send me books. I'm like, if she's sending me a book, I'm reading this cover to cover. And I did in like 2 days. And it was just even more of a just desire in me to figure this out and just telling myself like every one of my children, it's going to look different for each of them. But I would rather, number one, try to be on this journey with them, versus sending them out in the world for them to fix this later on in life. And number two, knowing that we can make the most impression now with them. So I am blessed in that I started with Bodywork because like I said, I've known a lot of people who've gone straight to palate expansion and don't even know what Bodywork is. Yes. So I think my kids were more prepared in that way. I mean, from the second they came out of me and I had 4 really great vaginal births, like I was in the chiropractor. Like I was undoing that damage and that trauma and those subluxations that are all there. Yeah. They're going to be there.
That, in my opinion, that should be like standard.
It should. Yeah. Those doctors should be like, okay, and now here's the address for where you should go to undo what just happened.
Yes.
I mean, I hate to say it, but you know, it's because it starts then. So yeah, with each of my kids, I mean, I got started earlier and earlier because I got smarter with each child.
I always joke that I need to have another kid so I can just get it right.
I'm not kidding. I'm not even kidding. I kind of did with our 4th. I'm like, okay, now I know. And he probably has the worst palate of all. And I'm like, it's really amazing how God does that. But it's been really cool. In fact, last night I looked at my 4-year-old as she was asleep next to me. And I took 3 pictures of her that I was going to send to you, and her mouth was closed. I could cry. Yeah. I'm not even kidding. I'm actually getting emotional because when she came out, this is a visual podcast, but some people may just be listening on audio. Literally, that mouth, her tongue, we called it a little lizard. Her tongue would not fit in her mouth. Wouldn't fit. I mean, I couldn't mouth tape that kid. That would be abuse. I had to figure out how to get the tension to go away enough. Do a little bit of myo, strengthen that tongue, expand the palate. Then we're going to clip. You know, there's stages you have to go through. But even before we have done her second revision, she had a revision, her release, buccal release. Even before the second one, which we'll do with you, she is already closing her mouth to sleep, which is huge. This child, again, like could not close her mouth if we tried.
That's amazing.
It's amazing.
And how long has she been in expansion?
Well, so she was in expansion, like, I guess, 4 or 5 months, and then it happened to fall out the worst day of the year because y'all went out on Christmas break and then you had your honeymoon. But she still has her mouth closed. I ended up not putting her back in because she had retained enough, and then we're gonna wait a little bit for her. But I'm so glad I did, and I had before and after pictures of her, and she went from that gummy smile to you can hardly see any gum, and there's space between her teeth. I mean, all of those baby teeth were touching with the gummiest little smile.
Well, and that's the impact you can have when we start early.
Yes.
You know, because the longer we wait, the harder those movements are.
Yes.
The more ingrained the habit of mouth breathing is.
Yes.
And that's the thing is you can try to address mouth breathing prior to doing some of this and you'll get some improvement. But if we don't have the structure to support it, then we're asking the body to do something it's not capable of. And the moment we give it the proper structure to work in, then that therapy is super effective.
Yes.
But that's also the missing piece in our traditional orthodontic world is we don't take the step to do the therapy after.
Right.
So we move the things around.
Yes.
And then we leave the muscles doing all the incorrect things, and they work against each other.
Exactly.
So it is really a combination of all the things that you've done with her. But these are the things that make a difference. And one of the hot topics is mouth breathing, which I love, because we didn't understand how detrimental it was until fairly recently.
Yeah.
And so if we can even just fix that one thing on every kid,
Yes.
that's life changing.
I mean, for a child to not go into deep sleep at the time that's most formidable in their lives, and then we medicate them and we punish them
because
for
that
their
is-
behavior.
They skip what's called N3 sleep. That is when growth hormones produce.
Right.
That's when our body truly rests, when our memory is solidified. You know, our chronic bedwetters, that's because that is the stage of sleep where your body stops you from bedwetting.
Yes.
But if you don't reach it, then you're in this very superficial state.
Yes.
And we medicate kids for ADHD all the time because that's how they present when they're not sleeping well.
Right.
And yeah, ADHD is a medical diagnosis. I'm not saying it's not anything, but poor sleep is definitely not going to help those children regardless.
Right. Well, and those genes can be turned off. I mean, I'm a big believer. If you look, I've done genetic testing on my kids because I'm just a curious parent and a little bit nerdy, but they have a bunch of reds and yellows. They're not a bunch of green genes. They're a bunch of SNPs. But my kids are literally never sick. They don't need to be medicated. Not only will they never be medicated, they really don't need it. But when their diet starts slumping, and I really do believe if we had not done some of this airway work, my second child has so many SNPs and the genes that contribute to ADD and dyslexia and ADHD. I honestly think that we would be having calls from teachers saying, listen, we can't, but you can turn those genes off with the choices that you make.
So I'm curious, now that you know more intimately than most parents the genes of your children, has it correlated to how they've responded to the airway treatment with their individual genetic makeups?
I mean, I would just say that seeing their genes, if you're a geneticist, which I've had one write into me, to my functional doctor, the functional doctor then sent me what she said. And she basically said, this child has a whole deck against her. And thank God she has the mom she has, basically, because she follows me on Branch Basics. But I would say that if you were to just look at the genes and didn't know the lifestyle of my kids, you would say, like, this mom is living a really difficult life right now.
But how did she respond to expansion?
I don't know if she knows about the expansion part, but the geneticist knows. I mean, she follows us intimately on Branch Basics. She knows that the choices we make in terms of the food and the environment and the steps we're taking with sleep. And she basically just said this child will be a completely different child.
And in terms of like the improvement from airway treatment, have you seen a difference?
Well, let's put it this way. My 9-year-old went from bedwetting at 5 to within 1 month of seeing you, we have not had one accident.
Oh, that's amazing.
And I mean, I have before and afters, and I will say it started with Bodywork in terms of what I'm about to say, but the bedwetting only went away when we started working with you. But Bodywork, took her dark circles away from her eyes. And I absolutely saw a difference in her jaw and is it the mandible, the lower jaw? Coming forward, even just with Bodywork, and I was very consistent.
And the Bodywork you were doing was osteopathic?
I was doing chiro.
Okay.
I had done a lot of chiro, and then this specifically was like every other week osteopathic for about 2.5 months. I was like determined. Yeah. And and then I started seeing you, so she just literally responded beautifully with you
because the body was ready.
In about 4 months, she was a completely different kid. I mean, you could like look at her, and then even just like her behavior, no more tantrums, no more bedwetting, no more dark circles, no more coming in the middle of the night, no more ending up with sheets on the floor. I mean, she basically just stayed in bed and slept.
That's incredible.
It's incredible.
That's really incredible.
Yeah.
And in a relatively short amount of time.
In a very short amount of time. And I truly do believe it's everything we've talked about, though.
Yes.
I think it's her diet.
Not just
I think it's the environment. I think it is the body work. I think it is dealing with trauma, dealing with mold, all of these different inputs.
So let's say there's a parent listening that is living your quote unquote traditional American lifestyle.
Yeah.
If you had to pick one thing for them to start with, what would it be?
Yeah, I love this question. I mean, obviously I'm biased just because of what we do with Branch Basics and just the stories after stories. I mean, our mission is to really help people heal. It's not to switch you over to using Branch Basics cleaning products. But I would say the cheapest and easiest first step is to remove the things from your home that you don't even have to tell your kids and your husband about. Because when you start working with diet, everyone's freaking out. Oh my gosh, mom's gone crazy. She's taken away all the candy. I'm talking, go to your laundry room and take away the things that are synthetic endocrine disruptors that are proven, that are literally going to be on your child's washcloth in the
So you're
shower.
talking about like
Detergents, soaps, all the things in your laundry room that literally follow them around from their pillowcase to their clothes to their washcloth. You never escape your laundry. So I would say the number one thing to cut their chemical exposure every single day, the thing they're exposed to the most 24/7 is their laundry. So go to your laundry room. But if you're someone who is using harsh disinfectants in your house every day in order to create a clean environment, so you have good intentions, these things are literally obliterating the gut bacteria. They are burning down the barn to kill the rats. We do not need to use disinfectants and harsh sanitizers in our home to create a clean environment. We need to use a gentle soap or surfactant, even the CDC says this, to remove germs and bacteria, versus this idea that we need to kill everything, because it's killing the good and the bad.
Yes.
And then our kids don't have
an immune system.
Yes.
Yeah.
Exactly.
Yes. And then obviously Branch Basics has a whole line of products to use.
Yes. Yes.
If someone is not going to use Branch Basics.
Yeah, which you do not have to.
How do you differentiate as a consumer?
Yeah.
Because everything says clean on it or
It's so
whatever.
confusing.
Yes. It's very confusing.
It's so
And our
confusing.
regulation system is maybe not the most,
The worst.
not the best.
I've tested 1% of the
So
chemicals.
let's say I'm a mom. I want to do this. I want to get rid of these toxins and I need to find a replacement product.
Yeah.
How do I look at a label and like decide, is this better?
I love this question. Number one, if there's no ingredient on the label, it should not belong in your home, because within the cleaning industry, which includes the disinfectants, the hand soaps, the dish, the laundry, I mean, it's a huge category. You do not have to disclose ingredients, which is pretty crazy. And so also there's a lot of self-regulation. And so you can basically, these manufacturers can put a product on the market and we are the test cases, and until enough people are damaged and have health repercussions, then they will pull them. So like in Europe, for instance, they use the precautionary principle, where ingredients are basically guilty till proven innocent. Ours are innocent till proven guilty. So we are the ones that take the burden. So anything with the word fragrance, we always say stop using the F word. But if it says the word fragrance, it is a concoction of multiple, it can be thousands of chemicals in that single word. So if you smell peppermint, you want to see the word peppermint oil. You want to see lavender. Even then, honestly, if you have someone in your family that is trying to heal, removing those essential oils for a period of time, because even those essential oils can be endocrine disrupting. Just go fragrance free. Just try to go back to basics. Your cleaning products don't need to be the thing that smells in your house. And that smell is not where the cleaning power comes from. The suds and the smell is just the show off part. It's not doing the cleaning. It's the surfactants that are really doing the cleaning. So finding products that are, if you go to the EWG Skin Deep database, you can actually put in ingredients and they're rated from like a 0 to a 10. You really want to
that in the show notes.
Yeah. You want to have all 1s and 2s. And if it's above a 3, you really should toss it out. And the nice thing about this is it's a finite process. Like once you find your product, you're done. It's not like food where multiple times a day you have to figure out what you're going to eat. I mean, like find the things that work. And I'm telling you right now, green can work. If it's done in the right way, if it's manufactured in the right way, it can be just as effective as your conventional cleaning products without the side effects.
I love that. And then for parents that may be thinking about like Airway and Bodywork.
Yes.
What are, like, as a parent, again, where do you start?
Yeah.
What would you say to them? You've obviously, I mean, I know so many moms that look to you for advice because they have recognized that you you do your research on what you're recommending, but you also hold your recommendations up to a really high standard. I mean, I know with Branch Basics, there was a point that you guys had to kind of pull back and rejigger things because you wanted to be at the
we literally
level.
shut down so that we could reformulate.
And that just speaks volumes to who you are and your, your level that you're looking for, not only for your family, but this is why, I have patients that come in that don't even know you that say, oh my God, did you see this thing that Allison Evans is talking about?
I love that.
And they're really looking to you. So I hope there's a lot of parents listening to this. And I would love for them to hear kind of your take on where to start. And also like what the journey might look like. And, just any tips as a parent that is really looking at root cause for their children.
Yes. No, I absolutely love that. I mean, there's so much that I could say here. I think that if you are blessed enough to have your eyes open and you have a newborn, or if you're pregnant, just getting that child into a body worker who really understands the importance of the spine, of the cranial bones, of the nervous system, of working with the vagus nerve, and really understanding the importance of releasing tension in that body so that the baby, or even, honestly, it doesn't even matter. Just if you're listening and you've never done body work on your kid, find someone that really understands the whole body approach, that understands the nervous system, is not just going to look at the spine, but is going to look at, as a cranial sacral therapist, is going to understand the fluids, is going to understand the visceral system. And that can be osteopathic, that can be chiropractic. I mean, unfortunately, it's hard to just say, oh, call X, Y, and Z profession and you're going to find, what you're looking for. But I think within chiropractic and osteopathy, you can ask certain questions. I think the word nervous system is something to be just highlighted when you're asking, because if they have never heard of that or really know what that is, which unfortunately is the case with a lot of body workers, I would say move on.
Yes.
Because it really is a whole body approach. So there's that. And then at the same time, almost, if I could do it all over again, which I kind of am with my 1-year-old, finding someone in your area, whether it's dentist, it's probably going to be dentist, but Airway. And just because they know Airway doesn't mean they're going to be perfect, but start there and go and ask the questions. And they need to be asking about your child's sleep. They need to be asking questions that you think have nothing to do with the teeth, the mouth, they need to be asking the hard questions. Are they waking up at night? Are they, asking about the circles under their eyes, like their behavior in school? I mean, these are the kinds of questions that people that really understand the Airway. And then I really highly recommend that if you go to someone first that's on the dentist Airway side, if they don't recommend body work, move on.
Yeah.
That's a big thing too. I think the two need to go together. It really does. And that's what's hard to find, but it's becoming more and more common. And I'll be the first to admit that I am still learning. I mean, don't you feel like you're still learning?
I'm still learning.
I mean, the one thing that's hard for me as a parent that has a 9, a 7, a 4, and a 1-year-old, so I've gone through this journey with all of my kids in different ways, in different stages, is figuring out retention of the work. You start earlier, and the earlier you start, the more you have to focus on how you're going to retain and keep the work that you're doing, because those bones are moving quickly.
Well, a big part of retention is what the rest of the body is doing.
Exactly.
And how much tension the rest of the body is
back to the body work.
The body work.
Yeah.
So we know that the body's either going to work with us or against us.
Yes.
When we start doing any sort of interventions. And so the kids that retain best at any age are the ones that are doing a whole body approach.
Yes.
That are really focused on getting those lips closed, nasal breathing, our tongue in the right spot.
Yes.
That are eating more whole foods.
Yes.
Versus our processed pouchy
I should have started with that. Get rid of the pouches.
Yeah, the pouches. So, if you have an infant and you look, or even a child, and you look back at their newborn photos, many of them will have their mouth open already. That's the time to start, is to look at it then, take them to a body worker. One thing I was going to say is what we ask when we're looking for body work providers is, do they work on the cranium and do they work in the mouth?
Oh, intraoral. I should have said that. They need to be able to put those gloves on and go.
A lot of them will not.
Yeah.
And we're missing a whole section of our nervous system and our bones if we're not going inside the mouth. So that's a good question to ask if you're looking for a body worker, is do they go in the mouth? Do they work on the head and neck area? Because some are just all focused here, but we know there's a huge connection.
The tongue, the rudder of the ship. It's what is it? Isn't it the strongest muscle in the body?
Yes, and it's connected to the fascia that goes all the way down to your toes.
The dural tube.
Yeah. So I have had school-age children that I've released their tongue tie, and unprompted, they will tell me they can move their toes better.
Oh, I love that so much.
Yeah, and it makes sense because
That's
it's the same connected tissue system. But yeah, I think retention is a tricky part that we're still learning as practitioners.
Yes.
Because we cannot put kids in long-term retainer at 4 years old because we need to have them continue to grow.
Exactly.
But what we've seen work best is when those muscles and the cranial bones are all working together.
Yes.
And we have minimized the strain that's on them and the stress on the body.
Exactly.
Those are the children that we see thrive.
Exactly. And bringing in the myofunctional therapy, which is essentially how the tongue affects the rest of the body. And I mean, learning, because I mean, it's one thing to create space for the tongue, but then all of a sudden it's kind of like this rudder that's trying to figure out, oh no, I have all this new space. What do I do with it?
Yeah.
And so this is where I'm sure people that are listening, some of you are thinking, gosh, this sounds really expensive. There's actually so much you can do at home in terms of myo.
Well, myo is like any other therapy. The real work is being the parent at home doing the stuff. Okay. When parents come to me with a financial concern, I tell them the better you are at home, the less the therapist actually has to see you.
Yes.
So you have to do the work.
And it's not easy.
It's not easy. It's not easy, but it's so worth it.
Yeah.
Because you are going to set your kid up for success. Airway, sleeping, breathing,
and you have it stuck.
Whole body health.
Exactly. I mean, like my 4-year-old, I say to her, listen, Eleanor, if you want to watch Peppa Pig, you're going to put your Myo Breeze in, Myo Munchie, and I'll put some peanut butter in it, maybe some jelly. I mean, I'll do whatever she needs to do. And I'm like, you got to chew on that thing as long as you're watching Peppa Pig. And so she's associated those two things together.
Such a great hack.
Yeah.
Is you have to give them a little bit of what they want to get what you want.
You do.
But build it into something that's already part of your routine.
Yes.
Otherwise, there's too many things to do.
Exactly.
Especially with 4 children.
Exactly. And I think the more we can educate and the more you believe something, the easier it is to execute on it. You know, if you just feel like, oh gosh, I was just told to do this and you're not really understanding the why, I just don't think you're exactly.
It's pointless.
Yeah.
And also as a professional, you know, prescribing some of these things, I think it's also important to take the step to explain to your patients the why. Because a lot of times as doctors, you know, you're trained to like, here it is, go do it. And people are supposed to, like you said, when you were in high school, white coat was king, right?
Yes.
We're not in that situation anymore.
Yeah.
Okay. Parents are coming in, which I love, knowing the things, asking the questions. So as a professional, if you don't know the answer, say you don't know the answer, but be prepared to explain the why behind what you're doing.
Exactly.
Because it's really important for them to understand.
Yes.
Because it is hard work. It's time, it's money, it's effort.
Yes.
And it's definitely not easy on young children.
Exactly. I want to add one more thing to people who are listening and they may be using a certain practice where you're feeling really confident about what you're doing. Maybe you're somewhere in California and your kid is in the ALF and you're like, well, shoot, y'all haven't mentioned that if we're not doing this certain thing. I want to bring this up. I think the most important thing is that you have somebody you're working with that is uniquely tailoring care to your child and is not doing the exact same thing with every single kid in the exact same order where it's just this cookie cutter approach. Because I think no matter what the mouth jewelry is, no matter what the device is, like if you're seeing results in your practice, one practitioner can use the same device and get completely different results.
Yes.
And that's what I've seen. Like I've seen a lot of people say, oh, well, the expander doesn't work, or oh, the ALP doesn't work. And other people are like, no, it works beautifully. I'm like, it's really in the person that is using the device. It's all about a unique approach. So don't think it's just this one size fits all. And if we're not doing what we're talking about here today, well, shoot, I've screwed up my kid. Like you'll know if you're a provider.
If it's working, it's working. Yeah. You know, don't question it, but you'll know it's working because you'll see the changes in your child.
Yes.
And that's a great point because something may not work in my hands, but it may work great in another practitioner's hands. The key is knowing what you're looking at.
Yes.
You know, what is going on? What are the issues we're trying to address? And then whatever you're going to use, make sure it's addressing those issues.
Exactly.
You're getting the outcomes.
Exactly.
So there are so many different ways to do things.
Yeah.
The number one thing is awareness.
Yep.
Just giving parents the tools to identify what's going on with their child, empowering them to find a practitioner that they're comfortable with, and then also recognizing that none of this is magic. You have to look at the whole body. You have to look at what you're feeding your kids, what you're exposing them to, and then couple it with a practitioner that can identify the barriers to better sleeping and breathing and health and work together.
Exactly. Yeah, I'm sure we just hit people with a lot of information.
Yeah.
Basically, remove the toxins, find an airway specialist. Don't forget the body work. They need to work together and respect each other and understand each of their roles. And by taking the toxins out of the diet and in the environment, it's really just catalyzing the entire process.
Yes. Yes.
So,
well, thanks so much for being on.
this was fun.
This was fun. And I hope everyone learned a ton. And we will definitely put some of the resources for Branch Basics
Yes.
in the show notes.
Yeah.
If any parents have any airway questions, please reach out to
Please
us.
direct them to Dr. Gandhi and not me.
We are definitely here to support y'all on your journey to better health.
Yes, thank you.
We